Hi guys, Dr. Chris and Dr. Corey here to talk to you again about our upcoming knee program that we have released. We talked last week about one of the three components to this program, and that was the structural component that goes with this. We have two other components to discuss. One is what's called a metabolic component, and then a neurological component. Metabolic component, think about everything internal, about the inflammation that takes place in the body. When you think about impingement within the knee, where it actually starts from is from the brain. We know that's your central nervous system. And the way that the brain communicates with the knee is it sends a message down through the spine. That spine sends a message down into the knee, and then the knee reacts. Now let's just say that message from your central nervous system is not working appropriately. It's delayed over time. Let's call that a subluxation, if you will, or a misalignment in that system. That delay over time causes instability. Instability of the knee over time can cause weakness, can cause deterioration, early wear and tear. But not only would it cause deterioration, it can also cause something called compensation. So just think if you have a bad knee, right? Or we can use another analogy. If you have your car, if your tire is out of alignment and you never change the tire, you let it go, go, and go. Over time, it's not just the tire that's the problem, but other parts of the vehicle can break down as well. So what we see with chronic knee problems, not only is it just a knee issue, a lot of times we can have foot and ankle issues, lower back issues, but where the metabolic system comes into play, that's the inflammation that takes place with this. When you have a chronic problem, it typically leads to chronic inflammation. So we deal with that inflammation here in the office. So many offices pay no attention to this component of this protocol, which is what separates us from everything else that's taking place for knee care. So if we're able to decrease the inflammation through nutrition, through our in-office work, as well as the home therapy work, if we can decrease that inflammation, open up that pathway from the brain to the rest of the body, your knee is in a much better place.
Yeah, no, I agree wholeheartedly. That was a big reason I wanted to be a part of this office is that wholehearted, holistic approach to the office, not just focusing solely on structure, but looking at what are you putting into your body, what should you be putting into your body, and what you should be avoiding was a big thing for me. And it's if you look at knee pain itself, it is multifactorial. You look at any research out there, discussions on the reasons for it, and it's not just the injuries to the meniscus or the kneecap. It's a lot more of what we're putting into our program to help patients.
So our goal is not, obviously we want to address the knee, right? We want to get that primary chief complaint. We want to get that to a better place. But what we're not going to just recognize is going to be laser focused and just have tunnel vision, just focusing on the knee. We want to look at other parts of the body to keep you whole and healthy so this problem doesn't continue to come back every 3, 4, 5 months. Yeah. Hope that helps. That's part 2. Part 3 is coming next.